Good afternoon, everyone. My name is Nika Babes Patalinghog, a first-year nursing student from Davao Doctors College, and today I will be demonstrating how proper complete bed bath is done. But before anything else, let me give you a short description or a short background on what complete bed bath or bed bath is. So, bed bath cleans the skin and helps the skin free of infection. It helps to relax the person being bathed and help them feel better. Take note that there are some cuts along the video to arrange the camera and have a better view of the procedure. With that, let's move on. Before we proceed with a complete bed bath, we must ensure that we have done proper hand washing to avoid and prevent the spread of germs and microorganisms. Then we're going to ask the patient's identity, explain to the patient what the procedure is all about, and at the same time assess them. Okay, good afternoon, sir. My name is Nika Babes. I will be your student nurse for today. Can you please state me your name, sir, and your birth date?
I'm John Mark Brobo, born in April 19, 2002.
Okay, so sir, for today, we are going to perform a complete bed bath wherein I am going to wash and remove all the accumulated dirt and oil in your body. Will that be fine with you, sir?
It's okay.
Okay. So sir, this will also allow you to feel fresh at your stay here in the hospital. Okay, so before we start, sir, do you like or would you like to void at this moment?
No, I'm okay.
Okay. Now after that, we're going to gather our the necessary equipments to be used for this procedure. And then we're going to don some gloves. After donning the gloves, we are then going to grab our bath blanket and place it over to the patient's chest. Slightly unfold it. Okay, sir, could you please hold to the end of the blanket? Okay. Okay. Yes, sir. Okay. Now after that, we are going to remove the soiled top sheet underneath the bath blanket slowly. Sir, please grip on the end of the bath blanket. Thank you. Sir, can you please lift your leg? Thank you. And then we're going to put it on our hamper. After that, we're going to remove the patient's gown. And now if the patient has a IV line, we're going to remove it from the unaffected area. Now since this is not applicable in this case, we're just going to remove it like so. Sir, can you bend it for me? Thank you. Okay, sir. Okay, bend your... Okay. Okay, sir, can you please hold on to the blanket? Thank you. Okay, after that, we're going to fill our basin with 2/3 full of warm water and allow the patient to check for the temperature if it is tolerable. Okay, sir, so can you please dip your fingers and tell me if the temperature is tolerable?
Okay, it's good.
Okay. Now we're going to proceed by washing the patient's face. Now in doing that, we're going to grab a bath towel and then place it at the head of the patient. Okay, sir, can you please lift your head? Thank you. And then another bath towel over the patient's chest. Okay, now we're going to start washing the patient's face by starting on the patient's eyes. Now we're going to grab our washcloth Dip it into the water. And wash the eyes, making sure that we are using different sides of the cloth for each eye. Okay, sir. And then we're going to pat it dry. Okay. After doing that, we're going to proceed in washing the patient's face. So, sir, would you prefer adding soap in washing your face?
No.
Okay.
I'm fine.
Okay, sir. Then we're going to pat it dry. So, sir, would you prefer or would you like me to shave you today, sir?
I'm okay.
Okay. Okay. Now, after that, we're going to proceed by washing the patient's arm. Let us start by grabbing the bath towel and place it underneath the patient's arm. Okay. After that, we're going to wash the patient's arm with soap and water. Okay. We're going to start in the hands to the shoulders. Okay. After that, we're going to proceed to the fingers. And then slowly lift the patient's arm to wash its axillae. Okay. After that, we're going to rinse. That's your answer. Thank you. Okay. Then after that, we're going to pat it dry. Then, apply the deodorant if we must. I think that. Now, we're going to do the same thing onto the opposite arm on what we did to the other arm. Let's start by grabbing our bath towel and place it under the arm of our patient, exposing the forearm of the patient, and then wash it with soap and water. Okay. Again, to the direction of distal to proximal. And then slightly raise the arm of the patient to wash the axillae. And then proceed to the fingers. Just relax your arms, sir. Okay, after that, we're going to rinse. And then pat it dry. After doing this, we can apply deodorant if we must. Can you please lift your arm, sir? Thank you. After washing the arms of the patient, we are going to then proceed to washing the chest and the abdomen of the patient. Let's start by removing the bath towel from the arms and then place it above the chest of the patient up to the abdomen, and then slowly pulling down the bathing blanket up until the umbilical area. Can you please grip on the towel, sir? Okay. Making sure that the patient is still covered. After that, we're going to wash the patient with soap and water. And wash the patient's chest and abdomen in a long gliding motion. Okay, after that, we're going to rinse. Again, in this motion. And then we're going to pat it dry. Okay, after doing that, we're going to proceed on washing the patient's leg and foot. Let us start by pulling back first the patient's bath blanket up to its chest. Okay. And then slightly open the bath blanket across to the other leg of the patient, making sure that the perineal is still covered. And then after that, we're going to place our bath towel underneath the patient's leg, lengthwise. Okay, sir, can you please help me lift your leg? Thank you. Okay. Now after that, we're going to wash with soap and water. Again, with the same direction as what we did in washing the patient's arm. Then we're going to rinse. And then pat it dry. Then apply lotion. Then we're going to do it to the opposite leg. Let's start by slightly opening our bath blanket across to the other leg, making sure that the perineal is still covered, and then putting our bath towel underneath the patient's leg in a lengthwise manner. Then after that, we're going to wash with soap and water. Again, in the direction of distal or proximal. And then proceed to the finger toes. And then after that, rinse. And then pat it dry. Okay, and then apply lotion if we must. After doing that, we can remove now the bath towel and then cover it back with a bath blanket. After we wash the face, the arms, the chest, and the leg of the patient, we're going to discard all of the used equipment, which are the washcloth and our gloves, and don another one. After that, we're also going to change the used water. After we have done donning our gloves, we are going to proceed on washing our patient's back. We're first going to position the patient like so. Okay, thank you. Okay. Making sure that the patient is still comfortably covered. After that, we're going to put our bath towel and tuck it slightly at the back of the patient from the shoulder to the bottoms. Okay, after that, we're going to grab our new washcloth and then wash it with water. Like so. We're going to start at the neck, to the shoulders, and up until the back. Then after that, we're going to pat it dry. And then we're going to remove our gloves and ask the patient if they want any massage. Sir John, would you like to have a massage?
No.
Okay. After doing that, we are going to place the patient or assist the patient to go back to its original position. Okay. And then we're going to grab a new pair of patient's gown and then assist the patient to wear it. Okay, sir. Thank you. After doing that, we're going to secure the gown, making sure that it is snug to the patient, and then slowly remove our bathing towel, our bathing blanket. Put it in the hamper, and then grab a comb or a brush, and then brush slightly the hair of the patient to its comfort. After doing that, we're going to assess the form of the patient if he is feeling comfortable and fresh, and then perform hand hygiene and document everything. Now that is how you perform a complete bed bath on a patient.